heartbeat. I'll get you some pictures of her face, but yeah, she's cramped up in a funny position
Yeah,
today.
why is her neck?
She's fine. The biggest challenge will be hard to get some of the views because she's sitting in such a funny position, but hopefully she'll move for us. And if there's anything that we can't reliably check today, we'll just follow it up next time.
Okay.
Sometimes the position that they lay in is just really tough for us to ultrasound. It's never a sign of a problem, it's just they're being stubborn at that minute. Yep. 146 on the heartbeat.
Okay.
This is her face like straight on.
Oh,
Wow.
This way and see if I can get her profile. Profile's gonna be tough with her current position, but hopefully she'll roll for us.
So she's facing outwards right now?
She's facing, let me come straight on. She's facing almost down towards your back.
Oh,
Okay.
okay.
So, like a little bit off to the side, a little bit down towards the back. This view right here is seeing her nose and lips. Well, she just moved. This is her ear.
Oh.
One of her ears. Her other arm and hand. I'm gonna start like taking some anatomical views while I wait for her to hopefully move into a better position to get you some pictures. This is her bladder here.
Okay.
So we want to make sure that the bladder is visible, which it is, and inside the body, which it is. So that's bladder right there. When I can see the bladder visible and a normal amount of amniotic fluid, which is all this black around her, that tells me that her kidneys, her urinary tract system, all that's working appropriately.
Great.
And then I'm going to check the blood flow around the bladder of the umbilical cord. Her leg is getting in the way here, so I gotta wait for her to move it. Hopefully she gets out of this funky position for us today. I'll come back to that. I can already see what I need to see. I just want to see it in a still image so I can take a picture of it. I'm looking to make sure that the cord is normal.
Okay.
We can check the vessels around the bladder, and that tells me that the cord is normal, so I just need to wait for her to move. This is her thigh bone or her femur. So we measure that. We take a couple of different measurements and put them all together to show that they're growing normally. That's measuring actually to the day.
Oh, wow.
Not all of the measurements are going to be to the day like that, but that's a good thing. We just want those measurements to be within 10 days of what we expect based on your due date. Some things in her head here. Oh, you are a stubborn little one. What kind of position we got going on here? Both hands. So you can see both hands are there. And there's both feet right there.
Okay.
Oh.
See the toes even?
Yeah.
And this is a finger. She's got a hand down there. So foot, some umbilical cord, and she managed to get a hand down there. But you can see her toes there.
Yeah.
This one I'm confident has all the toes. You're just missing a little bit, pinky toe is out of the view of this plane. We don't actually check for all the fingers and toes because they're minor things, right? Like if a baby's born with 6 fingers, ideally, we want 5.
Yeah.
But it's not something that we really check for on ultrasound. But you can actually see all 5 toes right there. Yeah. If I can get that little footprint picture again. So side of that foot and bottom of that one.
Oh, yeah.
Cute little feet there. This thing that looks kind of like a peanut shell in the back there, that's the cerebellum. That looks normal. And the posterior brain structures. You've been taking the baby aspirin, correct?
Yes.
Good. I'm going to measure one of the fluid-filled spaces in the back of the brain. It's called a ventricle or lateral ventricle. That's good. We want it less than 10 millimeters. It's 7.8, so that's good. It's looking really good. We look at this white stuff through here. See this?
Mhm.
It's called choroid plexus. So we want to make sure that there's no cysts in that, and that looks normal. So that looks good. Measurements on her head here. Everything looks great there. So head measurements are right on track within about a week or so of what we expect. That's great. Come back and see if she'll start to give us a profile. She's turned a little bit. See her hand.
Yeah.
She's still sort of facing your back, and so I'm trying to like swing over to the side here to see if I can get her profile, but hopefully she'll turn for us in a little bit. She's turned a little bit. I'm going to zoom back in and look at her. Just catching a view of her lip that I think looks good, but then as I come out and need to see it better, she's got her hands in front of it. You see those hands?
Is she moving?
Yep.
Oh, wow.
She sure is. Oh, now she's turned. I bet we can get some profile views. Yep, I'm just holding still. That's all her moving. See that?
Yeah.
So we're starting to see her profile now. Forehead, nose, and lips. Yep, so her body. Yep.
Okay.
It's turning for us. A little bit. There's some umbilical cord right in front of the nose there. You're like, what's that
those
thing?
bubbles?
Yeah, I know it does. It looks exactly like bubbles. And she turned back. She's playing with us a little bit. Come on, little one. Oh, you are cute. Cute little profile picture there. Let me stand up because I got to come over this side and let her. Umbilical cord right in front of her chin there, the little bubbles. That looks good. I'm going to come to her heart right now because she's got her heart in a... Oh, I thought she had it in a good position for me to look at it, and then she moved, of course.
Is that all belly?
Yeah.
Okay.
Mm-hmm. That's her abdominal circumference, so the belly and cross section. That black circle there is the stomach. This is the spine, or like three. You see kind of a triangle. That's vertebrae, and then these are ribs. The white out here.
Okay.
I'm going to measure the belly. We call this the abdominal circumference. Another one of our measurements, along with the head and that thigh bone that I measured, and that'll put together a guesstimate of how much she weighs right now. 11 ounces, so just under 3/4 of a pound is perfectly normal. All right in range.
She's tiny still.
Yes, very tiny still, but normal. So that's good. She is indeed a girl. Do you see? Okay, so let me see if I can show this to you. So as we come down, the bladder's in here, butt's back here, leg, and this is in between the legs here. So we're just catching like her hips, and the leg is starting to come out here.
Okay.
Right here, first of all, there's nothing in between the legs.
Yeah.
But also, I'll try to show you in a non-still image. We get these three little bright white lines in there. That's the labia.
Okay.
Oh, okay.
Let me see if she still has them wide open showing us. Kind of hard because her butt's so low, but it's right in there. See those
Yeah,
little white
I see.
lines? That's the labia. Yeah, so that's it again. So just not seeing the whole leg here because she's got it bent out of the plane, but like this is the low part of the lower leg. This is that leg on the other side. Put the word right by it so that when you're looking at these at home, you're like, oh yeah, that's in between the legs there. Butt's back here. Pictures of her face there. She was moving a hand in front of it. This is part of her hand. But she was fuzzy because she was moving it, and then umbilical cord. All right, let's go back and see if she was giving me heart now.
She's moving.
Yeah, she's moving a ton. She's making it kind of hard on me today.
You don't feel that, honey?
Well,
She's still so small. It's coming. A couple weeks. Within the next couple weeks. I need on the heart here. Oh, it's a beautiful textbook view. You're like, what are you looking at? But this is, I can see this track. I don't understand why it always puts it in the middle of the word. So you can see this black line going across there.
Yeah.
That's called the right ventricular outflow tract. And then I see two smaller like black circles above it. Those are a couple other like big vessels coming in and out of the heart. And that's the orientation that they should look like. So they're in the right place. They're the right size. And this the long black line there is from the right ventricle into the pulmonary artery. So it's showing blood flow out of the right side of the heart.
Okay.
It looks great.
Oh yeah.
Yep, so you can see it there.
Mhm.
It's classic. It's like textbook. It looks so good. You check a couple other things then on the heart here. See how it gets dark across there? It's because I'm getting a shadow through the bone of her arm. So I just kind of have to like work around until she moves it. She's being stubborn. I can see that she has all 4 chambers of the heart like she's supposed to. I'm going to come back to her because she just moved it now and made it kind of difficult. I'll take another picture of her cute face. Still got that kind of turned away from us there. Stop. There's another one with her nose, lips are there, and chin. See your hands moving there.
She looking at us now?
Mm-hmm.
Oh, she's moving her
Both
hands.
her hands.
Oh yeah.
I'm trying to look at her upper lip again. She keeps putting her hand in front of it.
She's shy.
Yeah.
There's this picture of her arm and hand. Like her thumb right there, and the rest of her finger, she's got to kind of like that. Alright, well, what else are you going to give me right now, little one? Keep being stubborn here.
She's like all over the place.
She's moving a ton. Can't keep up with her.
There's her torso.
There's
Oh,
a
there
nice
it
figure.
is.
You can see
Yeah.
heart, and then see this line going across there, and then this is the stomach on the other side. That's the diaphragm, that line across there. So I can see that it developed all the way across, which was great. You want to make sure it's all intact all the way across. Babies can get hernias or holes in the diaphragm. It's a big problem if it's a big hole. So hers looks good.
See her ribs.
Yep. There's that upper lip and nose. This is her lip and nose right there. Kind of hard to see, but the upper lip looks normal. So this is the nose. Think of it if you like kind of looked up my nose here. So the nostrils and that long white line there is the upper lip.
Yeah.
That's her whole upper lip?
Right here. We're just missing one side of it slightly, but what's really important is to look right under the nose, and that looks normal. So just making sure we don't see a cleft lip.
Mhm.
You can see like a big
Yeah.
gaping hole there, like
Yeah.
a black, like black.
Like then it
Yeah,
closes or
yeah.
something.
So it's so as I swing out, see her eyes,
Mm-hmm.
and I come out. This is her nose, like that triangle there, and then when you come out, it's right there.
Oh,
Oh yeah.
So you can actually in this one even see her lower lip. The black is the opening of her mouth.
Yeah.
Okay.
She's got her hands right like this around it. She like
She's
just gave us a
yelling at
little
us.
window. Mm-hmm. Just gave us a little window to see it there. Looks good. Oh, now are you turning over? Nope, and right back. Oh, stinker! She turned for like a second. Oh, there you are, a little bit. Trying to get your profile, but you just keep turning so fast, it's getting real fuzzy. There she is. Her mouth is open there, and she's got a piece of cord in front of it. It almost looks like
Oh,
she's
that's
swallowing the umbilical cord, which don't worry, they don't do. But it was so neat the way she, watch when I go back and forth, like you can see how she opened her mouth.
Oh, that's funny.
Fingers. See her hand.
Yeah.
Mm-hmm.
She's waving.
Mm-hmm. Right, she's got her heart up, so let me see if I can finish on her heart, because she's got it in a little better position now.
Oh yeah, I can see it.
Yeah, I don't get as much shadow though.
She's like,
And
nope.
then she rolled right back.
Not today.
Here,
Yeah,
see?
she's a stubborn little cupcake there. I can see the four chambers. I just want to get it in a still image where I don't have a big shadow through it. Oh, just move your arm. Come on,
Move your arm. Oh, sorry.
Alright, I guess we'll go back to that again. Looking at the base of her spine here. See the base of the spine looks nice there. So this is a picture where bladder's right in the center here, and you see the cord flow coming in. And when I put red and blue on, that's blood flow. And see how it's just starting to split right there?
Yeah.
That shows me that the cord is normal. So it's supposed to have 2 arteries and 1 vein. Sometimes one of the arteries is missing. Not for your kiddo. When we see that split around the bladder, that's the 2 arteries. That's how we prove both the arteries are there.
Okay.
So that looks great. Oh, that footprint. Oh, look at that foot. Wait, just keep it there, keep it there.
There
You
it
see
is.
it?
Yep. Oh, yeah.
Ah! How funny. How cute.
I
It's a
know.
perfect little foot. Let me see if she still has it there. I'll zoom in and take it again bigger. And it's gone. Flashing in and out. My goodness, little one, you do not stay anywhere for very long, do you?
It's a sign of things to come.
Mhm. Although sometimes they're crazy on the inside and chill on the outside,
Yeah.
so we'll see. Oh, corners of your face. That's a really pretty picture. See the profile and the heart is drawing so nicely. Okay, if you do not move this arm, I'm going to figure out how to spank you inside. One of the views I need to check in the. Oh. Come on. Oh, she's making me work for it.
I see that shadow going like.
Yeah, it gets so hard. It's like right when I get in the view that I need to check these other things on the heart, she puts that shadow
There it is,
right in front of it. Yep. Stop there. I hit this. That's what one of the views I wanted to see. This is left ventricle, and then see that like line going across there. That's the other side outflow tract from the left into the aorta, and we want to make sure that the right and left cross, and they do. So the right was going this way, and the left is coming that way, and that's what we're supposed to see. So again, the left was going like that, and then I can see the right again coming across there. Boy, is she fast. You are too fast. Ah! He's making me work so hard today. I always have to take my jackets off and like come in a t-shirt because like the ultrasound, they make me work so hard. I'm getting sweaty.
It's workout.
Right?
No gym today.
You're like, how is that? All I'm doing is ultrasounding, but somehow I'm working out. Maybe one of the best looks that we're going to get on the 4 chambers. I usually get it better where I don't have that outflow tract in there. 1, 2, 3, 4. Yep. Usually I can get it better where I don't have that, seeing the outflow tract at the same time. But she's being so stubborn. I've seen them in plenty of views. I just have not caught it in a... It's pretty good there though. 1, 2, 3, 4. I just haven't caught it like perfect textbook, you know, in a still image, just because every time I get it in the angle I need it, she moves her arm in front of it, but I have no concerns about it. I think it looks great. This is really like the angle to look at it, and then when I get there, she puts an arm in front of it. See the diaphragm there. See that line going across there right underneath the heart? That's the diaphragm there. The other thing is she's like laying off to your side, so I have to come all the way over here to get these views. See here her cord inserting into her belly. So I want to see it. It's a nice like smooth insertion with that kind of nice circular wall around the side. So that looks good there. ACI means abdominal cord insertion. That's what I'm writing. Jumping away. Showing us your face so nicely
now. That's cord up there.
I think it was cord and hand you were seeing. Yeah. This is hand right here. core by the chin here and up there by the face. She looks really good. Let me just mentally run through my checklist. We did placenta, cord insertion there, cord in the belly, brain, face, heart, spine, diaphragm, stomach, bladder, extremities. We are good.
Awesome.
She looks wonderful, guys.
Yay.
Still being stubborn to see if I can get up at a 4-chamber view, but she's like, nope, mm-mm.
It's your daughter, honey.
Yeah.
Does she have a name yet?
Harper.
Harper. That's beautiful. Love that name. Yeah, she's a little stinker. She looks really good, though. Congrats, guys.
Thank
Yeah,
you.
thanks.
No, she'd like my hands. I feel like this has been so hard on me. All right, she looks awesome.